Good day, I am Norbert Neil R. Marba and today I will be assessing the nose and sinuses. So what is nose and sinuses? Nose and sinuses are the interconnected structures which plays an integral role in the respiratory system. The objectives of this procedure is first is to observe and describe the appearance of the client's nose and sinuses. Second is to identify the signs of abnormalities related to these regions. And third is to document the findings and identify the need for nursing care and interventions. Safety security measures. First is proper hand hygiene. Second is to use the right tools and equipments and always follow the correct procedures. And third is to make sure to wear the proper and appropriate clothing. Pre-procedural preparation. First is wash your hands. Second is to introduce yourself to the client and identify client's identity. Explain what you are going to do, why is it necessary, and how the client can cooperate. Third is to gather the necessary equipment, and fourth is to provide privacy. So may gabiin ni mo dia, sir. Ako day si Norbert Neil R. Marba, mong student nurse karong adlaw, sir. Masa kaya itong pangalan, sir?
Norberto Marba.
Norberto Marba. So karong adlaw, sir, is atong i-assess imong nose and sinuses, meaning sa imong ilong diring dapita ta sa imong facial structure. So okay ra ba na, sir?
Okay na.
So okay. So mag-proceed na ta. So before we proceed, mangutana sa ta sa patient if na ba siya mga sakit ani. So first is mangutana ko, sir, ha, if na ba kay allergy, sir?
Wala.
Galisod ba ka ginhawa sa imong ilong, sir?
Wala.
Wala. How about sinus infection?
Wala.
Injuries to nose and face?
Wala.
Nosebleeds?
Wala.
Mga tambal nga ginatumad?
Wala.
Wala. So proceed na ta. So first is inspect the external nose for any deviation in shape, size, or color, and flaring and discharge from the nares. Second is to lightly palpate the external nose to determine any areas of tenderness, masses, or displacement of bone and cartilage. Next is determine patency of both nasal cavities. So to determine the patency of both nasal cavities, ask the client to close the mouth and exert pressure on the nares and breathe through the opposite nares. Repeat the procedure to assess patency of the opposite sides. So sir, pwede na to pwede ka maginhawa, sir? Pika, sir. Okay. So next is inspect the nasal cavities using a flashlight or a nasal speculum. Hold the speculum in your right hand and inspect the client's left nostril, and in your left hand to inspect the client's right nostril. So we're using a flashlight to inspect the cavities, nasal cavities of our patient. Next is to use a nasal speculum. Since we don't have a nasal speculum, and Ma'am Brenda also said that nasal speculum is not necessary. So I will just recite or discuss the procedure that I will be doing. So tip the client's head back. Facing the client, insert the tip of the closed speculum about 1 centimeter or up to the point at which the blade widens. Care must be taken to avoid pressure on the sensitive nasal septum. Next is stabilize the speculum with your index finger against the side of the nose. Use the other hand in position the head and then to hold the light. Next is open the speculum as much as possible and inspect the floor of the nose. the anterior portion of the septum, the middle meatus, and the middle turbinates. The posterior turbinates failure is visualized because of its position. Next is inspect the lining of the noses and the integrity of and the position of the nasal septum. Next is observe for the presence of redness and swelling and growths and discharge. Next is inspect the nasal septum between the nasal chambers. So we proceed for the facial sinuses. Palpate the maxillary and frontal sinuses for tenderness. So, tignan lang ko sir if sakit sir ha. Kani sir sakit? Kani sir sakit? So next is document findings in the client record.